Well, thanks for coming back again. This is the second part of the news items I wanted to talk about today for Sunday the 15th of March. Now, we just mentioned that Poland and Latvia, who have relatively small number of cases, have closed their borders, which is good because remember these trustworthy sayings. So this looks like fairly proactive initiatives from these countries that will help us to flatten the curve. So these are good and encouraging points. Now, moving on to other things. Now, I had a long chat with a friend in the Philippines in Manila today. So I got this news directly from her. I think most of it's substantiated by other news outlets, but it's always good to get news directly from personal contacts as well. Now, I did check on the website. Philippines has 111 confirmed cases, 11 deaths. Now, the Philippines, we looked at the amount of doctors per country. So the Philippines is kind of in between. Remember, Ethiopia only had one doctor for 10,000 of the population. So the Philippines isn't brilliant, but it's slightly better than some of these African countries. Now, they've only got one active lab in the country where they're doing testing. So testing is a real bottleneck at the moment in the Philippines. And remember, the Philippines has got a population of well over 100 million. So there's a lot of people, and quite a few of them live in quite compact cities, such as Manila, as we'll see. So this means that basically they can't test. So I think everyone in the Philippines would admit this is massively underestimated because of the limited testing facility that they currently have. But they're about to set up 5 more testing facilities to try and improve the situation. But even then, of course, it's not a lot for a population of 105 million. So at the moment, they're only testing the seriously ill. So they're testing on clinical grounds, purely because they haven't got the testing kits to do more than that. Now, Manila has announced what is described as a state of calamity. Now, I'm not quite sure what that means, but I don't like it. It sounds worse than a state of emergency. And they've imposed community quarantine on the metropolitan area of, or the metropolitan city of Manila. 20 million people. No domestic flights, no ferries. Now, the road access in and out, there is actually roadblocks, but people are being allowed in and out if they've got a good reason to do so, if the police decide it's appropriate. So it's not a complete close down of 20 million people, but people have to have a good reason for going in and out. Now, we found this several times in various places around the world, indeed including Wuhan in the early stages, that the lockdown for Manila was announced 2 days before starting. So a lot of people have left the city going to all parts of the Philippines. And this, of course, is quite a major concern, that people are going to all parts of the Philippines from here. The malls are closed except supermarkets and pharmacies, so basically all the shops are shut in Greater Manila. There's a curfew from 8 p.m. to 5 a.m, overnight curfew. Other cities in the Philippines are also locked down or are about to be locked down, and social distancing all over the country is to be enforced. So that is the situation in the Philippines. Now, the Philippines normally has completely crowded public transport, but there is gaps of one seat, empty seat, between people on public transport. So that's good. So this social distancing is starting to work, is starting to be enforced, and is being adhered to by the people as far as I'm aware. Now, this is remarkably concerning. All routine hospital admissions stopped. All routine surgery stopped. So given that they've stopped all routine admissions and stopped all routine surgery, that clearly means the 111 cases is not accurate. Emergency department admissions have tripled in Manila and in other areas of the Philippines, as far as I'm aware. The news I have for Manila is quite high quality news, so at least in Manila they've tripled, and probably other parts of the country as well. Now, for the country of 105 million people, there's 400 ventilators. Not need to say much more on that. I mean, the gap between the healthcare that is going to be required and the healthcare facilities that are available in so many countries of the world is so wide that it just terrifies me how many people might fall into that gap and die as a result of that. The impact in poorer countries of this disease is probably going to be significant. Now, Romania. 123 cases. Just out of interest, they've got 2.3 doctors per 1,000. When I was working in Romania, you seem to meet doctors everywhere. There seem to be loads of them, but actually statistically slightly less than in the UK. I think a lot of people call themselves doctors in Romania who probably aren't. Anyway, they're getting on top of that now, I think. So officially 2.3 per 1,000. From tomorrow, no one is allowed to get in or out of their homes. Just very rarely to go for buying food. €4,000 fine. So this is an email that I've received from a contact in Romania. So from tomorrow, no one. So basically, my contact here is saying that the whole country is about to be closed down. People are only going to be allowed out for food. Now, €4,000 is a lot of money to me. And in Romania, it's an awful lot of money because the wages are quite low in Romania. So that is an absolute draconian fine. And if that's the fine, people will be complying with the law because that is that's enough to bankrupt a lot of people in Romania. It's an astronomical fine by Romanian standards. Now, Australia and New Zealand have imposed a 14-day quarantine on everyone arriving in the country, which makes perfect sense. And I've just seen on the news as well that Australia is banning all cruise ships from docking in Australia. So if you're a cruise ship captain, don't bother going to Australia. Well, I suppose you could look at the coast, but you're not going to be allowed to dock. Now, the cases in the US, the United States, are officially this number. Again, this is ridiculous. It's massively higher than this, and that's going to grow exponentially over the next few days because in the United States there is community spread. And finally, although I did say this last week, but finally the United States does seem to be getting its act together on testing. And finally it's getting testing. So that means this official number is going to go up massively. I would imagine we'll be putting a nought on the end of that before too long, unfortunately. Now, this guy's writing in Medium, which is an interesting interesting way to write. It's not peer-reviewed, but he's saying to flatten the curve would take 10 years in the United States. In other words, to go from this sort of position here, where we have a big spike, as we looked at on the previous video, where we have a big spike of cases and all these people can't get treated, to flatten the curve in the United States, to keep it below that dotted line, which is the ability of the healthcare system to cope, he's saying would take not 1 year, but 10 years. As I say, that's not peer-reviewed. I don't know how accurate that is, but it's certainly an interesting supposition that epidemiologists might like to look at further. Now, of course, it won't be 10 years because next year we're going to have a vaccine. I sincerely hope in 2021 we have a vaccine. Now, if we do have a vaccine in 2021, that will be the fastest vaccine for a virus ever developed in the history of humanity. So it just shows the amazing strides that have been developed, achieved in vaccine development, but it's still going to be 2021 at the earliest before we have an effective vaccine, or probably several vaccines, hopefully. American Airlines have grounded most of their long-haul flights, 75% reduction. President Trump is negative. He's been tested for COVID-19 and is negative. Travel bans from Europe now include the United Kingdom and the Republic of Ireland. Free tests have now been guaranteed, and there's now some drive-through testing. So thank goodness the United States seems to be getting its act together on testing. I'm not going to comment on the delay. It's just hard to believe, quite honestly. The delay in testing for a country like the United States is just beggars credulity. It really does. But I'm glad it's happening now. as I say, that means that number is going to dramatically rise. There's no question about that at all. Now, France, just by way of interest, 3.2 doctors per 1,000. 4,481 cases, 90 deaths. That's 2% death rate. These death rates are panning out higher than I would have hoped for. And the thing to remember is this is in France, which is a sophisticated country with a sophisticated healthcare. And this is at the start of the epidemic where most people who need healthcare will be able to access it. Because although the healthcare facilities in France are severely stretched at the moment, they're not yet overwhelmed as they are likely to be. And yet still, with a reasonably well-functioning health service, we have 2% death rates. That is very concerning. Proactively, though, as I'm pleased to see, France has got a national lockdown. My country is going to have to go this way soon. I don't see any way around that. Non-essential public places are shut, so restaurants, bistros. These mainstays of French life are closed down. It's a very significant thing. And the government officials are saying that this lockdown is the only way to prevent mass fatalities, as we saw with a red curve. So to get this curve down with these stringent measures, in the view of the French government, is the only way to prevent mass fatalities. And I must say I agree with the French government at this point. Spain, terrible exponential growth in cases in Spain. Great increase, a lot of deaths, and even though we're relatively early in the explosion in cases in Spain, still the death rate is 2.97%. This is really quite alarming. I mean, this death rate, for example, is higher than the Spanish flu or the American flu. It actually originated in America of 1918. It's actually a higher fatality rate than that, probably, although the data from 1918-19 is somewhat difficult to accurately interpret. State of emergency in Spain. I think they're in the second day now of a 15-day lockdown. Restaurants are all closed. In fact, I don't think they're even doing takeaways. So Italy the restaurants went to doing takeaways. In Spain, I think they're only doing home deliveries. So I think in Spain, not only can people not eat in restaurants, they can't even go to restaurants to pick up the food. It has to be delivered. Public gatherings are banned and people are being told to stay at home except for work and essential shopping. Draconian, but it's the only way to stop the spread of this virus that we know at the moment. German cases are increasing. Israel cases are increasing. Now, I can't find separate data for the Palestinian territory, so apologies to Palestinian friends about that. But if you were planning on going to the Al-Aqsa Mosque for prayers, don't bother. It's shut. And I'm saying that casually, but it's not casual. I mean, to shut the Al-Aqsa Mosque is just such a huge step. That mosque has such massive significance throughout the Islamic world. To shut it is a very, very, very significant thing to do. Italy, increasing cases, increasing deaths, and this number here, it's 6.6% of cases. It's frightening. Now, one of the reasons for this, and I'm only talking somewhat spontaneously now, I am doing some thorough research into this, but it seems in Italy, and Italian doctors can correct me if I'm wrong, but it seems in Italy the use of drugs to reduce fever is common. Antipyretic drugs such as paracetamol, which is acetaminophen, or Tylenol, ibuprofen, which is a non-steroidal anti-inflammatory drug, or aspirin, which is a simple non-steroidal anti-inflammatory drug. All these things will reduce fever. And from the data I'm starting to collect now, again, I can't give you a definite peer-reviewed opinion on this at the moment, but from the data I'm starting to collect now, it's looking like reducing the fever actually increases. Looks like reducing the fever actually increases the death rate. Now, as I say, I'm awaiting more data in that. Now, there is precedent for this sort of thing. In Iran, for example, my understanding is that people use a lot of steroids, corticosteroid drugs. And it looks like using steroids has dramatically increased the death rate in Iran. So, in other words, the symptomatic treatments we've got at the moment seem to be making things worse. But hopefully get that research together and get a video on that tomorrow. At the moment, though, I would suggest that everyone thinks twice if they have COVID-19. If they've got a fever, I would think twice about reducing it with fever-reducing medication such as acetaminophen, paracetamol, ibuprofen, aspirin. At the moment, if it was me, I wouldn't do that. I'd just let the fever run its course. But more data on that tomorrow. Lockdown in place for a week, cases still increasing. Now, this isn't too surprising. This is not saying the lockdown in Italy has failed. I don't believe it has failed. I believe it is starting to work. But this, of course, is the delay effect. Because remember, the incubation period for the disease can be 2 to 14 days, with a median about 5 to 6 days. Remember, a lot of people get a very mild illness. So the fact that the cases are increasing after a week actually doesn't surprise me. It doesn't surprise me. And it doesn't mean to say the measures aren't working. I suspect the Italian lockdown measures are working. And like me, you've probably seen these moving videos of people going to their balconies and applauding and singing and such things from their balconies as they're confined to their individual homes. Now, again, I like reporting things firsthand if I can. This is an email I've received. Lombardy is the richest area in Italy and it is one of the best health systems in the world. I think you know that. In just 10 days and despite quarantine and other restraint measures, the situation has become like a war. In some cities of Lombardy, there are many corpses that there is no space for everyone. Now, this is directly from people in Italy. Now, hospitals are putting corpses into the churches. And situation is worse every day. Government is telling that dead people is dead with coronavirus, not for coronavirus. In other words, what this person is saying, the government is saying people are dying who happen to have coronavirus. Whereas this writer is saying, no, the coronavirus is the cause of the death. The writer says, obviously this is not true because before 21st of February, there were not so many deaths. I think you like to know information from a COVID-19 red zone. I hope you can tell everyone to stay in home from now yet because this is very worse than anyone could think. Austria. 655 cases and Austria being quite proactive and pleased to see here. Gatherings of more than 5 people banned. Whole population has to self-isolate. Now, again, another email, eyewitness account here. Tyrol, this area in Austria, is de facto quarantine. We are not allowed to leave home except for important work, grocery shopping or medical reasons. This is controlled by police and not to comply may lead to significant fees, in other words, fines. We may leave the house to go for a walk, but only alone or with persons we live with. That makes sense. This is also controlled. Police will break up groups. Only when you are out alone will they not engage you. Restaurants are closed for good now, so are playgrounds and other common facilities, indoor as well as outdoor. And he's saying they have 800 cases now plus, so it looks like my information was out of date. So eyewitness account there from Tyrol in Italy. Iran, the cases are rising. We know they're higher than this. Satellite image, distressing satellite images shows mass burials in Iran. Canada. Canadians told to come home now while the flights are still available. Told to avoid overseas travel. Quebec has emergency decree, health emergency decree. 70 pluses are being advised to stay at home, older people staying at home. And they admit limited testing capacity in Canada. So Canadian citizens are being advised to fly home while they still can. And again, eyewitness account from Canada. Canada has started proactively postponing schools, encouraging, despite cases not reaching many parts of the country. So they're being proactive. For 2 weeks after March break, schools will continue to be closed. Of course, that will be reviewed after that. Large gatherings are also cancelled or postponed, and the Prime Minister himself is in isolation where his wife recently tested positive. The federal government has also provided $1 billion to help provincial governments prepare and bolster up vulnerable communities. R&D, research and development, is also getting a chunk of money. So good to see Canada being proactive there. And Romania. Romania has only got 1, 2, 3 cases officially. But let's look at this again. Eyewitness account from Romania. I'm happy to inform you that here in Romania, the authorities have taken serious measures for stopping the spread of the virus. From Monday tomorrow, no one is allowed to get out of their homes. So it looks like a national lockdown again here in Italy. Just very rarely to go for buying food. Those who don't respect these measures will be paying a big fine, as we mentioned. People who come from other infected countries are forced to stay in 14-day quarantine with periodic checks from the police. If the police don't find them, they are fined and they get a crime file. So quite draconian measures there in quite a few countries with police enforcement, as happened in Italy. But my understanding again is that most people understand this and are going with it. They're accepting it. So we're seeing increasing cases all over the world, unfortunately. This pandemic is unfolding, as indeed I feared it would do back in January. It's quite distressing to see that the thinking that I had back in January and February is coming to fruition. But it seemed like it was going to be this way when we looked at the transmission characteristics of the virus. Let's get that curve flattened. Otherwise a lot of people are going to die. Let's keep moving from reactivity to proactivity. As we've seen in the closing of borders, closing borders can achieve this. Now I've been told off for this, so I might retract it. Elbow bumps, some people say that elbow bumping is too close, so we could debate that one. Whatever you do, don't sneeze all over the place. Don't put your bugs all over the place. Hand washing, never forget the basic things. Because of that. And as is happened in China and as is happening in other parts of the world, healthcare must be of the people, and it's us that need to do it by the people. We need to do this, as well as be led by the government, because it's for the people. So we're seeing Europe develop into a huge pandemic epicenter, which is something that is just completely outside the experience of living memory.